Hi and welcome to Herida Healthcare Limited. We have created a range of videos which are used to support instruction of how to best apply each sling type. Our videos are to be used as a guide only, so please note that a full assessment must be taken by a qualified carer in every instance prior to a lift. First, a thorough inspection of the sling, binding and webbing must take place. If it is worn, torn or ripped in any way, then please discard and do not use. Equally, you must make sure you are aware that the sling and hoist demonstrate the maximum user weight clearly, and also that you are aware that the patient you are about to lift fits comfortably within the maximum weight limitations. The sling must also have an individual serial number that allows traceability for its model and design. Slings with loop attachments must be applied to hook-type spreader bars with loop configuration, and slings with clips must be applied to peg or clip-type spreader bars with clip configuration. Never use either design on a non-configurable spreader bar. These videos, as shown, are of clip design only and must not be confused with either design or application instruction. It can be often intimidating being hoisted for the first time. Therefore, always clearly communicate your lifting intentions while providing reassurance both beforehand and throughout the lifting process to your patient. The patient sling and hoist falls into the regulations of LOLA, or Lifting Operations and Lifting Equipment, and PURE, Provision and Use of Work and Equipment Regulations, and must be treated as such. For further information, please visit the website at hse.gov.uk. Our Severn universal slings with clip fittings are popular models due to their shape. The cut of this product allows easy access or application in both the seated and lying positions. The design is available with or without a head section to support those with limited neck or upper body support. They are also available in a wide range of materials and size other than the one shown in this video. Now we will look at how to fit a universal type sling, like the Severn, from a sitting position. Ask the patient to lean forward, supported by the carer as necessary. Place the sling behind the patient's back in a seated position as shown. Now tuck the sling under the buttocks, taking care not to pinch or nip the body mass. After the sling has been applied behind the patient, gently ease the leg sections carefully under each limb.
Hold on to that for me.
When the sling is in place and the patient is comfortable, reduce the height of the spreader bar, avoiding the patient's face and head at all times. Place the desired clip to the bar, ensuring that the correct and comfortable position is achieved. Offer the clip to the spreader bar at an angle. Once the clip is fully over the protruding part of the spreader bar, pull the clip at an angle from the larger hole down towards the smaller hole until the clip clicks into place. The instruction "pull down to lock" is clearly identifiable on each sling clip. Repeat the exercise for all 4 clips. Only use the sling for lifting purposes when every single clip is locked safely into position. Please note that some patients' clinical conditions may require various positions where multiple clip choices are available, and as such, a trained carer must always conduct this activity. Tighten the straps by hoisting under tension gently until lift is ready. It's important to communicate the process to your patient throughout the procedure. Fitting a universal type sling like Severn from a lying position, bed or floor. Please note that if a patient has fallen onto the floor and the purpose of the lift is recovering from this, you need to establish if spinal or neuro damage has occurred prior to the lift. If you find yourself in these circumstances, please seek specialist help from a senior clinician. When lifting a patient from a bed, always raise the bed to waist height to minimise stress on the carer's back. Always use a Severn sling design with a head section fitted if lifting from a bed or the floor in order to fully support the head throughout the lift. Ask the patient to roll onto their side if they're capable of doing so. If the patient needs assistance to roll over, this should be done at the shoulder and the hip areas. As the patient is placed on their side, roll 1/2 of the sling and tuck it in gently into the back and buttocks as shown, taking care not to pinch the skin. Lay the sling out straight in readiness for the next step of the process.
And then over towards me.
Roll the patient over onto their side and unroll the sling so that it is fully open, interfacing the floor or bed surface. Then place the patient carefully on their back and gently pull out any creasing. The ideal position for the patient's hands is for them to be placed on their stomach or by their side during this process. If your patient is on the floor, lower the spreader bar and open the legs of the hoist around the patient's head. If your patient is in bed, the legs of the hoist should be placed underneath the bed. Place the leg support sections underneath the legs and feed the clips to the spreader bar. This is done by offering the clip to the spreader bar at an angle. Once the clip is fully over the protruding part of the spreader bar, pull the clip at an angle from the larger hole downwards to the smaller hole until the clip clicks into place. The instruction pull down to lock is clearly identifiable on each sling clip. Repeat the exercise for all 4 clips. Only use the sling for lifting purposes when every single clip is locked safely into position. This procedure should be followed unless the patient's clinical condition dictates otherwise. Raise the spreader bar gently, ensuring that no nipping of the skin or unnecessary pain is transferred to the patient. Regular communication and reassurance should be provided to your patient throughout the process.
Everything okay?
The spreader bar or strapping, if selected, on the rear of the sling can be used to steady the patient during the lift. A full risk and safety assessment should always be conducted with patient and surroundings prior to any lift. Do not attempt to lift any patient during any circumstance without the appropriate training. Moving and handling vulnerable patients is a serious business, and Herida does not endorse unsafe or underqualified staff throughout any lifting process. If you are unsure, please contact a supervisor or line manager within your workplace who will be responsible for correct procedural lift and training policies within your own site.